So I'm here with Dr. Paul Anderson, who formed a new group, AAMP, Advanced Applications in Medical Practice. And we are in 220 and we're coming towards the 7th International Live Conference for AAMP. Things are moving forward very quickly for you, Dr. Anderson. This is now becoming one of the fastest growing integrative conferences in the US. So you must be doing an awful lot right. Please share some of the background.
Well, advanced application started from a desire to do a couple of things with the goal of advanced application training for physicians. And there's a number of things that we try and do to serve that purpose. So the first thing that we implement is we really understand that most people have the basics on many things. And so unless it's absolutely necessary, we really don't start and retread the basics. We get right into either what's new, what is different, or maybe some new ideas around either diagnosis or treatment or assessment. The other thing that we do is we try and give you very high value for the time that you're there. 3 full days, Friday, Saturday, Sunday. And instead of having a large number of speakers presenting a large number of new research, etc., we normally have myself and usually 4 other experts in the field covering their own area of expertise. The final thing that we do, in addition to starting not with the basics but getting right into it, is we build a 3-part curriculum. We have 3 days and we try and have a focus for each one of them, so you feel like every day you end with something that you can wrap a bow around and take back to your practice.
So having taken it back to your practice, this is a 3-day conference, but there's always questions coming back from the doctors once they start assessing the notes from the meeting, treating patients. How do you fulfill the follow through with these doctors to help them on their way?
Yes, and that is something that became very apparent early on, and that we built this in from the beginning, that with an advanced seminar, there's going to be some things you maybe are very adept at and some things that are brand new to you. So what we do is we have 2 live webinars that we also record, because not everyone can be on live, that follow each of the AAMP meetings. You can send your questions in ahead of time, and I will answer them or get the input of the other speakers and answer. And we also do live Q&A. And so we have a mixture that allows you to get back to your practice, and about a month later and then about 2 months later, maybe you've tried some things, maybe you've seen some things or talked to other physicians about it. We can get back and go over questions and answers. And the other thing is, we all know there are so many levels of depth. So you might have an hour presentation that you may actually have to go back and listen to get some of the levels of depth and the shades of gray and other colors. So the other thing, in addition to the live and recorded webinars we do, is everybody who has paid for their registration automatically gets not just the slides, but all the audio recordings. So if you want to go back and listen to 2 of the talks or all of the talks, you can do that. And many people tell me they appreciate that.
Obviously, educational credits are very prevalent to our physicians. What do you cover during these courses?
Yes, so we almost always have 18 AMA Category 1 credits, and they're also countersigned by a naturopathic medical school, so they're good for all US jurisdictions and Kono for naturopathic credits. We also, through both our ACCME provider and our naturopathic provider, get pharmacology and some ethics credits. So 18 total credits, and we usually have something in the neighborhood of 8.5 to 11 pharmacology credits. So we really cover a lot of CME in 3 days.
That sounds good. Now, obviously, during a CME environment, there's a lot of information that can't be shared during the course. How do you cover that?
Yes, so in order to keep with the CME rules, which we're very careful to stay within, we have a number of ways to get information that might not fit into a CME talk. So we have take-home notes from each speaker that are separate from the CME environment, but maybe a speaker has a very favored, laboratory or supplements or medications they use, etc. They can give that all to you separately, and we put those together for you. You get them electronically and in paper if you want. And the other thing is that we have breakout sessions after the CE clock is over, either short talks by specialists or breakout sessions where there's a Q&A, maybe a demonstration of something technological, and it's a small group to allow you to have some feedback and questions.
Well, we thank you, Dr. Anderson, once again for sharing your knowledge with so many physicians who want to learn more, and we wish you well with your future endeavors with the AAMP Conference Series.
Thank you.